The Human Optimization Podcast is proudly brought to you by Vicon Supplements, where quality meets sustainability. Vicon's all-natural supplements are handcrafted and sustainably produced in Canada, bringing you products that nourish both your well-being and our planet. Visit ViconSupplements.com today and be a part of a greener, healthier future.
Are you ready to embark on a journey to the best version of you? Join me, Lisa Pitel-Killah, as I dive deep into the world of hair tissue mineral analysis and functional medicine with fellow experts, and guide you on the path of unlocking your full potential. As a multi-time kettlebell sport world champion, I'm on a mission to reach high-performance professionals from around the world to help you minimize tiring symptoms, maximize health, and gain unstoppable energy. This is the Human Optimization Podcast. Welcome, everybody, to a brand new episode of the Human Optimization Podcast. And for those of you who caught our last episode with Dr. Biamonte, you are going to be excited to continue the journey and learn more about nutritional testing, herbal supplements, and how side effects of medicine can actually make you more sick. We're going to talk about that today. All right. So let me tell you, if you didn't catch the first episode, you need to watch that. And you need to get into the book Candida Chronicles and take a read, because you're going to be mind blown when you read that book. Now, Dr. Biamonte is the founder of the Biamonte Center for Clinical Nutrition. He's the co-creator of BioCybernetics, which is an unprecedented computer software program, and I want to know a little bit more about that too, that is able to study blood work, mineral tests, and many other lab tests to determine exactly where your body is imbalanced initially, and it was designed actually for aerospace purposes. As a practitioner for over 30 years, he's dedicated to improving the lives of his patients and helping them get back to living. Welcome back to the show.
Thank you, my dear. I'm very happy to be here.
Yeah, well, I'm happy to dive into some new and fun topics that we didn't get a chance to dive into last time.
Sounds like a deal.
Yeah. And so tell us a little bit more about, so let's start with just a little bit of background on you and even the Candida Chronicles. Share a little bit on that, just for those that haven't caught our first episode.
Interesting, because this also goes into one of your earlier questions about biocybernetics.
Yes.
Biocybernetics is a computer software program that was initially requested by NASA from Grumman. And I worked on the project for quite some time. It was really the first thing I did when I got out of school after I finished my doctorate degree. And when we were utilizing the biocybernetics program, people, well, first, just to explain what it is, it's a computer software program that uses, and this is now a bad word nowadays, it uses artificial intelligence. It has thousands of algorithms, which enables it to look at many different types of testing, but primarily blood testing and mineral tests. And it can determine to the exact physiological pathway where someone's body's imbalancing. And when it finds that imbalance, it's able to look at what nutrients are needed or lacking, or what toxicity might be present that's causing the problem. When we were using biocybernetics, we had a great success rate in rebalancing people's body chemistries and helping them with whatever their illness was. But there was a 30% population that had weird reactions to the vitamins. And upon investigating them, we found out these people always had weird reactions to vitamins and medications. So it wasn't just the vitamins we were giving them. This was a 30% population of our group who didn't respond to vitamins. Vitamins made them sick. So I made it my point to research. I volunteered to research why this was and what was wrong with these people. And I found out that they had some type of intestinal infection. Now, in those days, we didn't have the word dysbiosis. We didn't have microbiome. We didn't have all these words we have now. So I had to dig a little bit to try to find out what the infection was. And it turned out that in most of the people, most of that 30% had Candida.
Right.
So I didn't know what Candida really was then.
Yeah.
So I had to research it. And lo and behold, that's how I got into Candida. That was my, and that again, that's why the book is called the Candida Chronicles, because it chronicles my own personal journey through understanding what Candida is and then finding what the ultimate way to treat it would be.
Yeah. Amazing. Amazing. And so, and in that book, which I just ordered today, by the way, just so you know, I saw your name come up on my calendar. I'm like, I haven't ordered that book yet. I need to do that. You actually go through the 5 phases of treatment, right? And
Yes, I
actually
explain.
talk about those and explain them.
Yeah.
And so I think for anybody listening, we all, even in the health space and as practitioners and clinicians, know how difficult it can be to treat Candida and actually, be successful, right? Because it is very difficult.
This is what challenged me and why I made it, why I dedicated myself for so many years to figuring it out. It was because it just appeared to be the ultimate mystery. Every
Mhm.
doctor I spoke to about treating Candida had a protocol that he liked, but they didn't work. They worked
Mm.
for a while, and then the person kept getting relapses.
Yep.
And that's the most prominent thing about Candida is the fact that people continually relapse from it. And that was the key question that I wanted to answer, is why do people continually relapse from it? And what I found was interesting. It was a mixed bag of things. The
Hmm.
first thing I found out is that in many cases, the person was never rid of it in the first place.
Ah.
In many cases, the person had suppressed its activity to the point where they felt better, but
Hmm.
they were only a few bites of some bad carbohydrate to have it come back.
Right.
And other cases, I found that the person had not handled the underlying reason. And that's where in my new book on Candida, which is going to be the more of the practical guide of how you actually do my program that's talked about in the first book.
Hmm.
In the new book, we're going to talk about triggers
Yep.
and causes, because there are things that can trigger Candida, which would be bad diet, taking too many antibiotics or certain
Hmm.
medications. And then there are true underlying causes that a person can have. And one of the underlying causes I found that had to be resolved, otherwise the person was eventually going to relapse, were mineral imbalances. And it
Right.
could be either end. It could be mineral deficiencies, like we know molybdenum, selenium, magnesium, and
Hmm.
copper deficiency makes you more prone to Candida.
Hmm.
But then it also could be mineral excesses.
Right.
Iron toxicity makes people very prone to Candida. So does copper toxicity from a hormonal viewpoint.
Yep.
And then we have the good old toxic metals like mercury and arsenic, which work in mysterious ways on Candida. I don't think anyone has still figured out exactly what they do,
Hmm.
but mercury and arsenic seem to be absorbed by Candida cells
Oh, interesting.
and apparently used as some type of a nutrition.
Hmm.
And then we have aluminum, which is one of the elements that most people don't look at. Aluminum is interesting with Candida because aluminum directly affects the pH of the body
Hmm.
and affects Candida from a pH viewpoint. Aluminum is an element which makes you very alkaline,
Hmm.
excessively alkaline, which is what Candida likes.
Right.
Most people in the health field are brainwashed into thinking the more alkaline you are, the better, because they don't understand balance.
Hmm.
In your intestinal tract, the pH, a normal healthy pH, is somewhere between 6 and 7.2. And we refer to that or think of that as being more acidic than
Right.
alkaline.
Yep.
And when the pH goes above 7.4, Candida just takes off. It just loves that pH. And vaginally, there's a corresponding range because in a woman vaginally, a pH 3 or below keeps Candida under control. But when it goes above 3.5, that's usually where you get a yeast infection. And
Mm.
that's where some of the home kits for determining what you have going on vaginally, that's what they do. All they do is look at vaginal pH.
Yeah.
And they just assume that if your pH is over a certain point, then you have a yeast infection.
Hmm.
And this is why women are also encouraged to douche with boric acid,
Yep.
because it's an acid substance which will reduce the pH and get rid of the Candida. And this is also why we have a probiotic which is named Lactobacillus acidophilus,
Hmm.
is because acidophilus and bifidobacteria release fermented acids which lower the pH, thereby eliminating the growth of Candida. It's confusing for most people because when most people are on a program to reinoculate their probiotics, those fermented acids that they release cause bloating and gas.
Right.
So the person is apt to think, oh my God, my Candida is coming back again. But one must understand that if your body's properly set up and you've eliminated your Candida and now you're going to reinstate the probiotics, you're going to go through a period of bloating and gas, which is a good sign, and it means the probiotics are working. It's not a bad thing.
Yeah. Well, and I think too, correct me if I'm wrong, but I think as well, I feel like Bacillus acidophilus has gotten a bad name in the past decade, right? I feel like a lot of practitioners are looking for, and I never say it right, but it's ramosis. Like there's different types, and even the bifido and things like that. Like I just feel like it's gotten a bit of a bad rap, and a lot of clinicians have gotten away from it and are going more spore based and using other things.
Do you mean spore based? Do you mean soil based organisms?
Well, and so I know that. So there's two types. So soil based, I always remember it was years ago. There was a soil based one. It ended up getting taken off the market. I think it was called Prescript Assist.
Okay.
And that one was around for a while. The other ones are would be spore based with like the HU58 or the DE111 from Deerland. So yeah, and I think those, I don't believe they're soil based.
Okay.
Right. But they've been touted to really be able to make big changes in the GI when there's chronic infections at hand. And I've always kind of thought through that, thinking, geez, even when you look at a company like, they've been around forever, Natron, right? Natron is a company, and they have that three-phase step process.
Very popular probiotic line.
Yeah, and they have the acidophilus and everything in there. Like that's what they've always done, and I mean that's been 2 decades plus at least. And so what do you think about, like, what do you think with regards to the probiotics that people now have kind of migrated to, and how that also affects the challenge with Candida? Do you think there's a cause and effect there over time that changes?
Over the shoulder back here,
yeah,
there's about 50 books on probiotics, textbooks. And what the textbooks tell us is that Lactobacillus acidophilus, or Lactobacillus species, are the predominant bacteria that we're supposed to have in our small intestine. And that's not just looking at people in America, that's looking at people throughout the world.
Everywhere. Yeah.
That is the prominent species. The books also tell us that bifidobacteria is the prominent bacteria in the colon, which works with glutathione in your liver to help your body detoxify. We've also know by observation that the fancy species of lactobacillus that companies argue about, that my product has X amount of this certain species that's known to do this or that.
Yep.
Those are mutations that come about from your basic lactobacillus. So a person can be impressed and can want to take all these fancy strains. The real truth is, once they get their main strain of lactobacillus back in their intestine, these other strains are going to naturally occur.
Right. So interesting.
As far as the Ramos, this is interesting because it's never been dominant. There's no study that ever shows that it's dominant. I admit that I have this bacteria in some of my products, and I used to call it's like sort of like a neutral space taker.
Okay.
So what it will do, and E. coli, friendly E. coli that you can buy in Germany, actually as a supplement, a gram-negative supplement, does a similar thing. It takes up or occupies space in a neutral manner. It doesn't go through the functions that lactobacillus does. Lactobacillus helps your intestinal tract synthesize vitamins, and it helps stimulate fecal IgA and IgE. Rhamnose, I haven't seen any evidence clearly that it does that at any high degree. It's taking up space in a neutral fashion, which then prevents the acceleration of other dysbiotic organisms, let's say, other bad guys.
Right. That makes sense.
It grows like wildfire.
Mm.
It grows like spinach grows in India, like a weed all over the place. So that's what makes it popular and usable. But again, it's not what the textbooks tell us your major bacteria should be in order to synthesize vitamins and do all the other functions that the probiotics are supposed to have.
Got it. That makes sense. Okay. And so let's dive a little more into, and we can kind of correlate this all into Candida, because again, it's just so interesting. So obviously we talked about the BioCybernetics, right? And so that's something you're still using, or you have a different, because you're basically using testing and to be able to identify what someone's needs are, and then kind of looking at it from a holistic perspective. Share a little bit about that.
Well, the BioCybernetics system is kind of like a whole deal unto itself. And my protocols, more specifically, are dealing with people with Candida. So they tend to be a little bit different, and they don't always incorporate that particular system because it's not hitting into the niche that you get in. With Candida patients, there are certain tests you have to run because those tests reflect where their weak areas tend to be because of having had Candida.
Got it.
What BioCybernetics is more doing a complete analysis of their entire biochemistry, which is not necessary to bring the Candida patient back up and out.
Got it. Okay. And remind me what your favorite tests are for Candida, or some of the ones that you use to identify those.
Well, we have our own at the Biamonte Center. We have our own proprietary test. It's a urine test that's done at home by the patient.
Okay.
And that test measures free radicals from Candida, and it measures Candida waste products and proteins.
Amazing.
Commercially available, you have from Great Plains. I'm sorry, they're now called Mosaic Labs.
Yes.
You have the organic acid tests,
of course,
and of which the key you want to look for is arabinose. That's the key organic acid for Candida. And then you have from various labs stool tests, which need proper interpretation.
Right.
The stool test actually can give you the most data, but if you don't know how to interpret them, you can go totally in the wrong direction.
Right.
I just wrote a chapter for my new book, which explains how you interpret stool tests, because you will hear from people that they got a stool test done and they said there was no Candida, and the doctor believed it, and they went on from that point, and then the person never got better, and they kept thinking to themselves, the Candida thing kept hanging up. And the reason why, which is covered in this manual, and if anyone listening would like to get a copy of this chapter, they can just email me, and I'd be happy to email it to them, because it's a fascinating point. Essentially, Candida as an organism is very difficult to test for in the stool, because Candida doesn't grow in a uniform manner in your intestinal tract.
Right.
When you look up at a building that has moss growing up the building, that's kind of how bacteria grow throughout your intestinal tract. They're very evenly, and they coat it, and it's very nicely represented. With Candida, that's not true, because Candida grows in a kind of splotchy, blotchy kind of pattern throughout your intestines. And stool, not being a homogeneous liquid where all the constituents are very evenly dispersed and represented, it makes it hard for a stool sample to show you Candida. And the same thing is true of parasites. So in the modern stool tests that we have, they do have parameters which you can look at. And even though the stool test shows no Candida, if these other parameters are going in the wrong direction, you can say this is a positive diagnosis for Candida by this stool test, even though this Candida didn't show. And in with some of these parameters, you would have to wonder if you really understand them as a lay person or a educated person in the subject. You would have to sit there and say, how could this person not have Candida with these parameters off the way they are? How could Candida not be growing in this case? So a simple example of this is somebody who has no lactobacillus show up on their stool test, no bifidus bacteria show up. How could they not have Candida?
Right.
What's protecting them from the Candida overgrowing when you don't have lactobacillus species or bifida species?
Yeah.
And luckily for me, I happen to know all this firsthand because back in the 90s, the lab that we have nowadays that's called Genova Labs used to be called Great Smokies Lab. And I was very fortunate to be quite friendly with Steve Barry and Marty Lee, who were the two directors there. And they allowed my patients, well, they allowed me actually to do an in-house study. And they allowed a bunch of my patients to submit a stool sample every week for about 6 weeks. And we got to see how things varied. And the bacteria end of the test was always very stable. Whatever if they had Klebsiella, the Klebsiella kept showing on every test. If they had no lactobacillus, it kept showing no on every test. But the Candida levels were all over the map.
Right.
1 week you'd get a person with a 4+ Candida. That same person the next week had none. Then the next week he had a 1+. Then he had a 4+ again, and it was just so unreliable. And so I'm the type who likes to reverse engineer things. So I would have been great at Area 51, reverse engineering the alien spaceships. Because when I look at this, I say, well, why would this be? Why would the Candida levels be so inconsistent? And that's how I led. That's what led me to the realization that I just said before, that you're dealing here with an organism itself which doesn't grow in a uniform manner.
Right.
And you're dealing with a sample medium which is very inconsistent.
Yep.
Stool is not urine or a liquid with everything mixed nice in there. It's all chunky and clunky, and it's not evenly distributed.
Yeah. Oh, that makes total sense. Makes total sense. And so I know that you mentioned it last time, and I'm assuming that those markers that you talk about are in that chapter.
Yes, they are, all of them, and they're all explained.
Perfect. So for those of you practitioners that are listening that use GI map or oat testing or work with Candida, you're definitely going to want to email. We'll make sure the contact information is in the description for that.
Yeah, the more people that read this, especially practitioners, the less confusion it will cause, because practitioners want to people want to believe the test. The test is an authority. So you want to believe it, but the problem is in some cases you can't. You have to question it, and you have to look at it from a few different perspectives.
Yeah, no, I agree. I agree for sure. And so let's talk a little bit about too, just with regards to, I mean, you talked about the different strains, the basics, and I think that just that approach is so commonsensical to me, right? Whereas that's going to go out into the strain that people are trying to market, right? This is what it's all about. It comes back around to ultimately. And so, what about with regards to we're talking about, deficiencies, imbalances. You kind of mentioned those earlier, especially from a mineral perspective. But some of the medicines that can be involved where, people could be ultimately making themselves sick. Let's touch a little bit on that.
Well, I would invite everyone to turn on TV, probably put on any channel, and just wait for a commercial to come on for any drug. Yeah. And there are certain drugs that are kind of famous for causing certain problems. For instance, and it's comedic, in my opinion. Like, we know just off the top, we know antibiotics, steroid medications, antacid medications are a leading cause of Candida in people. Antacid medications because they alter the pH of your gut.
Yep.
Well, there are other medications that do crazy things that you would never think of. And my favorite example are statin drugs. Now, a person takes a statin drug because they're trying to control their cholesterol, because they have been brainwashed by the media who hold up the Framingham study as the Bible, which it's totally flawed. But the idea is that cholesterol causes heart disease. And it really doesn't. Cholesterol no more causes heart disease than a gravedigger causes death. But people are brainwashed into taking statin drugs because of this. It's the great fear.
Yeah.
The problem with statin drugs is they cause CoQ10 deficiencies. So now what happens when you get a CoQ10 deficiency? You're more apt to have a heart attack. You get muscle cramps, muscle weakness, muscle lethargy, and the heart is a muscle.
Yeah.
So that is really not so good if you think about it. But yet doctors will swear to their last breath that the person needs to take statin drugs. It's a huge business.
Yeah.
There's there's data now coming out about how bad fish oil is for people. And when I first heard this data about that fish oil was bad for people, the first thing I thought of is, well, the sales for statin drugs must be dropping.
Oh.
Because you're getting people who, instead of taking the statin drug, now are going out and taking fish oils. So now they've got to, the old joke is with a study, whoever pays the piper calls the tune.
True.
So somebody must have said, gee, we better watch out because we're losing money. Quickly get a study together that shows how fish oil is bad for you.
Wow. And when you said that, I'm like, I haven't seen that study. Wait a minute. What's going on here?
Yeah, that's a new one.
That's wild. Yeah. And ultimately not all that surprising.
You know what the funny thing is? If you look at this historically, and I'll go back to the 70s. This is a little bit hard to research because not all the data is on the internet from way back then.
Right.
But you can find a skeleton of it. When vitamin E was really popular in the 70s,
yeah,
and there was a period of time when then there was all of a sudden there were all these studies saying vitamin E was bad for you.
Oh goodness.
And whatever vitamin became popular,
yeah,
all of a sudden there was some studies after that popularity that showed it really wasn't that good for you. Now most of them got buried because they were bad studies and weren't true.
Right.
But it just goes to show you the manipulation that big pharma and the media has. And I'll say big pharma and the media together, because when you start really looking at these things, you find out it's the same people. It's all the same group of people. Big pharma and your media, they're the same people. When you look at who's on the board of directors of drug companies and who's on the board of directors of all of these media outlets, it's all the same people.
Yeah.
So they very conveniently can manipulate things.
Right. Oh my gosh. Yeah. That's and that just gets frustrating. Well, and you think about even from a perspective of, some of the practitioners that are listening or even the end users, but the end users have that extra level to dig through, right? We have enough confusion at our level. And then now you get to the next level down and you've got all the marketing involved in all of that as well. And all the media. And it's terrible.
True. It is terrible.
And so confusing. That's people come to you, right? And they're like, I don't even know what to do anymore. I go on the internet and there's 15 different things and I don't even know where to begin.
And now artificial intelligence is unfortunately making this worse.
Yeah.
So recently there was this mass media on a diabetes cure that was invented by Dr. Oz. And they showed Dr. Oz being interviewed about this.
Yeah.
And they showed people like Tom Hanks and other celebrities on TV shows talking about how Dr. Oz had cured their diabetes. You want to know, it was all 100% a scam. They used artificial intelligence to put Dr. Oz there talking about it. He didn't know anything about it. Tom Hanks didn't know anything. It was all artificial intelligence. Kelly Clarkson recently won a lawsuit with this company that used artificial intelligence to put her image and her words in her mouth, talking about this weight loss product that she took. She never heard of the product before.
Wow. This is wow. That's a whole other rabbit hole that is just going to get worse and worse, unfortunately. And it's something that could be so useful, right?
Well, thank God the writer's strike sort of nipped this in the bud a little bit. They did nip it in the bud, and these are the ramifications of not.
Right.
Is you get these horrible people and using technology to impersonate others and try to sell something which is not true. I actually bought this product.
Wow.
That Dr. Oz allegedly made to cure diabetes, because I was very curious. As I got the product and I looked at it, and it's a CBD gummy that's loaded with sugar, and that's all that's in it.
Oh my gosh.
Now, can you imagine these people out there buying this product? Dr. Oz says that this is his cure for diabetes. So they're all buying this. It's CBD and sugar.
Wow. Yeah, that's absolutely
terrible. And they're diabetics.
Yeah. Even worse. Oh my gosh. Oh, okay. I digressed. So, on that note, in your experience, your decades of experience, I want to know if you had one thing to tell people about health and healthcare, what would it be?
It would be to eat organic and especially eat non-GMO.
Okay.
The second thing would be find out your blood type and go buy the book, Eat Right for Your Blood Type.
You are the second person that, so I have to, for those of you watching, just give me 10 seconds here. Hold on. So, I was on a podcast. I hosted someone a few weeks back, and he made the same comment. And I was like, oh, I have that book. I bought it like 20 years ago. I literally have it on my desk because I was like, oh, I need to reread through this and like look through this again. And now you've just brought it back into my wheelhouse one more time.
Well, when I was in school, when I was in college for nutrition, one of my instructors was Dr. D'Adamo. Not Peter, who wrote that book,
Yep.
his father. His father actually did most of the research, in my opinion. And Peter got all that research and correlated it and put it together and packaged it, and he has all the books.
Yeah.
So I firsthand read some of the original transcripts from his father and understood what was going on with blood type. And it's very simple. Your blood type is partly your genetics. It may not be like a 23andMe test,
Yeah.
but your blood type is your genetics, where your body comes from and what it's used to. So an analogy I like to make a lot is now you couldn't take an Eskimo and bring him down to the Caribbean and expect him, he's now all of a sudden going to shift his diet and eat papaya and coconut and all of this. His body's not used to that. His body's used to eating a lot of raw fish, a very high EPA diet, very high in fat.
Yeah. Yeah.
So, and you wouldn't, and conversely, you wouldn't take the guy who's living down in the Caribbean, who every day takes people out on a tour boat or swimming or snorkeling and bring them up to Alaska and now expect him to eat that diet. That would be insane.
Yeah. Yeah.
So to some degree, your body has gotten used to the diet that it's been consuming for a long time based on the geographics of it.
Yeah, that makes sense. And I do go back to this sometimes too, just because of the fact that, I do feel better when I eat a certain way, right?
Right.
So it totally makes sense. Yeah. And what would you say, what are some of the, being in clinical nutrition, what are some of the pitfalls that you see people fall into, especially now? I feel like when you go into even a health food store or a grocery store that has a health food section, there's lots and lots of pitfalls in those sections that people think are healthy but really aren't. So what would you say some of the major ones are for you, or what some of the common ones?
Well, as far as foods go, there are a lot of foods which are questionable.
Yeah.
You have to really know the coding when you go into a supermarket or a produce section. If you don't really know the coding, and the coding is pretty easy to get on what is organic to what percentage of it is organic.
Yeah.
If is it GMO or not. So you really need to know the coding, because the FDA allows people to say something is natural if it has a certain amount of the foundation of the product is natural. So if you want to buy a natural vitamin, the vitamin most likely, actually, the active ingredients are all going to be synthetic vitamins. That's an industry standard. There's nothing, no one's hiding that. But they'll call it natural because it's in a base of alfalfa.
Right.
So they can call it natural because of that. So that's something people need to look out for.
Yep.
Along with the coding on the food to know if it really is organic, to what degree it's organic, and etc.
Yeah.
Those are pitfalls right there. The other pitfall is that, you're being told by the media that this vitamin is good for you. Therefore, everybody should go out and buy the vitamin. And we have that with vitamin D now. Because vitamin D for years has been the big one. And unfortunately, that's not all it's cracked up to be. Vitamin D, if you take too much of it, will imbalance your magnesium. It will cause you not to be able to assimilate magnesium.
Yep.
And if you do a hair mineral test, you'll see you can spot high vitamin D takers because their magnesium is very high because it's not being assimilated correctly. Also, vitamin D works more as an antibacterial function in your body. Vitamin D works with calcium and copper and your thymus gland and your lymph system to arrest and stop bacteria. It's not so much antiviral. In fact, it can make viral conditions worse if you take it. And vitamin D makes Candida worse.
Oh, that I didn't know.
Yeah,
Okay.
that's the problem, because if you don't know this, if someone has Candida and doesn't know that vitamin D will make it worse, that's a bit of a problem.
Yeah. Yeah, absolutely. That's interesting.
So now you're going to get people who are going to say that's not true. How does he know that? Okay. So what I do is I invite these people to look up a drug called ketoconazole, which is a very famous, very well-known industry standard antifungal, and read the mechanism of action of the drug. You're going to find out that how ketoconazole works is by blocking Candida's ability to absorb vitamin D, which makes its structure fall apart when it doesn't have that vitamin D.
Yeah. That's so interesting. And, and it is, vitamin D has been like a thorn, when it comes to mineral testing and things like that for a long time. And now I find as well, it's not about, we take everything, I feel like, from a marketing perspective, and we say, this has benefits. And then we go, you know what? Let's multiply that by 5 then and take that, right? More isn't always better.
No, it isn't.
Yeah. And I mean, you get some of these people, they're coming to you and they're taking 10,000 international units of vitamin D. I'm like, what? Why?
Oh, well, it's because my doctor said it was low in my blood. But what's not being told is that about 10, 15 years ago, blood levels of vitamin D were changed. So that unless you were taking a supplement of vitamin D, your level could not be normal. Now, when I was growing up, vitamin D deficiency was a physical symptom that you would observe in someone. It would be rickets and mottled teeth. Those were the two big physical symptoms of vitamin D deficiency. And if you didn't have rickets and mottling of the teeth, it was considered you didn't have a vitamin D deficiency.
Yeah.
But then when people started taking vitamin D as a supplement and they started finding out that it could could give you more benefit as a supplement, this whole thing changed to the point where we're not differentiating what's a deficiency and what's a supplement dose.
Exactly.
Because a deficiency will produce vitamin C deficiency, we know produces scurvy, right? Niacin deficiency, we know causes pellagra. A vitamin B1 deficiency causes beriberi. We all have deficiency named diseases out there. Now, they've never established, like, what do you call it then? Or I guess the best way to say this is they reworked it so that now there's a new interpretation that if you're not taking a vitamin D supplement, you cannot have a normal level. You're going to be called deficient, even though you're technically not clinically deficient because you're not manifesting rickets or mottled teeth.
Yeah. It'd be very comparable to saying someone has a food intolerance versus an anaphylactic allergy.
This is a good point.
Yeah, yes. Very same. And I even find some people now have gotten to the point where, they'll mix those up too and say, oh, it's an allergy. Okay, well, what happens when you eat it? Oh, well, nothing. I just don't feel well. I'm like, okay, that's an intolerance.
Right. Or that's you.
Right. Yeah. Right.
That's you. Maybe you just don't like it for some reason.
Yeah. That's just an intolerance. If you're in the hospital and need an EpiPen, that's an allergy.
That's an allergy.
Those are two totally different things. Yeah.
Well, when you start to study that field, you start to see there are a lot of differences. There's a lot of different types of allergies.
Yeah.
There's a traditional histamine reaction. There are different antibody reactions. And then there are different sensitivities that you have to use white blood cell testing to determine. There was an allergy test once that was very, very popular. I don't know what happened to it. I think they changed the name of it, but it's where you expose your own white blood cells to this particular food or substance and see how the white blood cells do within the period of a few days.
Yeah.
And that's sort of like a delayed allergy test.
Yeah.
But there are many reactions that could occur.
Yeah.
And when people talk about this, they don't talk about it precisely. It's all jumbled.
Yeah. And confusing, right? We go back to that. That headspace of just being confused because there's so much information and so much I don't even want to say data because that's totally unfair. It's just kind of verbiage that people are, exposed to, and then they're super confused. Yeah. So tell us one last thing. How did you arrive at your specialty? Was it your own personal journey that brought you there?
And being inquisitive, I think, ultimately
Mm,
was what did it.
yeah.
And what threw me over the edge is when I was 17 years old, my father had cancer and he was terminal. He was going to live only like a year or two.
Hmm.
And I asked the doctors, I said, well, I see you're giving him chemotherapy and all this. What about vitamins or nutrition to build him up?
Yeah.
And they said, well, none of that works. And those, well, and then I had a friend who was a nurse, and she told me to ask the doctors if they've heard of Laetrile, if
Mhm.
they will try your father on Laetrile. And I said this to them, and it was like I had cursed in their face. And they just been really incredibly insulted that I
Mhm.
would say this word Laetrile. Well, I didn't know what Laetrile was. I just only know my nurse friend said. So then I
Yeah.
started researching what Laetrile was. Laetrile was a substance that they were calling vitamin B17, and
Oh.
it actually it's cyanide. Laetrile is found in the pits of fruits that have that
Mhm.
bitter almond taste.
Mhm.
And you can go on YouTube now and see videos about how it works. But Laetrile is a substance which, when it's used properly, the cyanide in the Laetrile is actually released into the cancer cells, and it will kill the cancer cells
Oh, interesting.
when it's used correctly.
Yeah.
But they didn't want to know anything about this, so I was saying to
Mhm.
myself, why are these doctors so hostile
Mhm.
about nutrition and vitamins? I said, there's got to be something to know about this.
Yeah.
If they're so against it, because first thing that struck me is, well, this has got to be a vested interest, and they've got to be in competition somewhere with this illusion of vitamins coming into the forefront, which eventually happened.
Mhm.
So that's how I got really interested.
That's amazing. Yeah.
Cynicism, a critical cynicism of the doctors.
And
Mhm.
curiosity for sure. No, that's great. Well, you know what? The work you're doing is amazing. And the fact that you're writing, and again, just make sure you grab your copy of the Candida Chronicles. And if you want a copy of that new chapter, just with regards to the GI identification markers, make sure you email and request that. Be definitely some invaluable information. And yeah, thanks for joining me again. I appreciate your time and always just sharing some amazing aha moments for, everyone watching and listening.
Well, it's been my pleasure.
Yeah,
We'll
thank
do it
you.
again.
Thank you. Yeah. And so, for those of you watching on YouTube, make sure you subscribe to my channel, give this episode a thumbs up. And for those listening on your favorite podcast host, make sure you like this episode, and we will see you next time. Thanks for joining us today on the Human Optimization Podcast. Episode technical production is by Grace Sylvester and guest booking by Stu Tate. Want to learn more? Visit lisapitel-killah.com for incredible free resources to supercharge your journey to becoming the best version of you. If you enjoyed this podcast, please like and subscribe to the Human Optimization Podcast and follow me on social media at Lisa Pitel-Killah.